again, I'm from Segal Medicare Experts. Been doing Medicare, as Erin said, since we were about 13. I basically started in telemarketing and back in those days when it was Medicare risk. So I love working with sales and FMOs and agents and health plans. We work with everybody. And the next slide kind of just gives you a little overview of us. Next slide. And so that will be on, I'm not going to read through it, but essentially we are a little bit different. And we've worked a lot with CMS. We have former CMS people working with us. So it's kind of like we learn all about the test and help everybody pass the test. And so therefore, on the next slide, I just have a summary to catch us up and make sure we're on the same foundation of what's been going on. Essentially, you know, we have the final regs, and this is a summary of what you all know already. But in April 2024, CMS did the finalized rule, and they were changing the way compensation is for brokers and agents. And of course, amid that, also curbing kind of incentives and trying to make a level playing field. We know they're still working a lot on that. In the meantime, there's litigation led by organizations in the sense of saying that basically this is really not in CMS's authority. And it's just like providers, where health plans contract with providers, and CMS does not state how much you must pay a provider. They stay out of that because it's health plans contract. In the same way, it's the health plans contract with brokers and agents. And so it really needs to be collaborated on. And therefore, this is kind of a summary of the FMO lawsuits, which the Texas judge, federal judge, stayed the rules, saying basically it's fixed right now in contract terms, so essentially can't go forward. And you know, lawsuits, I've only been in one lawsuit, and it lasted for 4 years. Hopefully this does not last that long. I don't think it will. I think my crystal ball says it'll come up soon, but it will take the gears a while to get in motion. And so essentially the compensation for MA brokers and agents can change due to the new regulations, but it's important to keep abreast of everything. I know Erin does a great job of communicating with everybody about the changes. And so you can get a heads up, and hopefully you all are subscribed to her station so that you'll stay on the same page and know when things have to change. It's really nice to hear it from somebody that trusts that you, a source that you trust, instead of hearing it all through the grapevine.
Exactly, Shelley. So I just want to pause here. Just want to remind everybody as we go, if you have questions, you can put them in the chat. Genevieve is going to be monitoring the chat box for us. And I don't know if we're ready to talk about this yet, Shelley, but one of the things that we've noticed as agents and brokers is in the past, we've had the ability to co-market with different health plans, you know, potentially get dollars to focus on growing membership. Do you see any of that being lifted, or are you hearing any rumble on the street yet as to how that's going to look for open enrollment?
I know there's been a lot of rumbling, mostly from health plans and health plan CEOs meeting with CMS and the federal, trying to get their sense of what should happen. But I don't think CMS is ready to make any statement. I know we see a lot of things happen very quickly with the new administration. They decided one thing and then they put it into effect the next day. But I don't think this is going to be one of them. I think now is the time for health plans to work together and FMOs and everyone to basically get on the communication trail and let CMS know and the federal government know about what we think would work. There are some agencies like HICE that work together to come up with one voice. And the more that we come up with one voice, we might be able to lead that to the place we want it. And hopefully that can happen. But right now, I don't see any kind of answers. some
Gotcha.
things are already set by the final government. Did I answer your question, Erin?
You definitely did. You definitely did. And let me just pause for a second, Shelley. Before Shelley continues, Jen, are there any questions so far in the chat?
No, there's no questions right now.
Okay, great. Thanks.
So you can definitely ask me questions. I'm available just as much as we have a website, Segal Medicare Experts, and we have a chat box, so you could chat with me anytime and ask me any kind of questions. I love to get stumped. Excuse me. And I don't charge for questions. If I essentially know the answer, I'm going to share it with you because we're all in this together on one page. So again, just going over some of the background, some things in the federal final rule state, for instance, about sharing distribution about personal data by TPMOs, third-party organizations, marketing organizations. And it has been before where organizations shared from one agency to the next. So that what it did, of course, it made a lot of beneficiaries get multiple calls and emails and, packs of documents because their names were everywhere. I know I get a call almost every day from organizations that are doing construction for houses. I made my house, I created in 2004, and I'm still on the list for new construction and needing help. And it's like 21 years later, and that's not what it should be. But beneficiaries, we want them to get the best information and get helped. And so I think this is a good thing to be compliant and ensure consistency is not to have that beneficiary shared unless there's consent with the beneficiary for them to do that. Erin, can you talk a little bit about how your organization works with data and sharing data?
Well, I think a great way to talk about this is we have a lot of partners with local providers. So when we see, for instance, a situation where a carrier might exit a particular market, one of the things that we're careful about is making sure that the information, the beneficiary information, never crosses our hands. So it'll go directly to a third party to do marketing and mailing. Even if the client is making inbound calls or calls on behalf of the provider, it's all done by a third party administrator so that we don't have access to those names or that information or sharing that. The other thing that we've done to protect our information is that we have a CRM with extra security on it to make sure that beneficiary information can't be accessed. So being careful in those ways. Is anybody else out there doing anything that they would want to share? Any best practices to make sure that we're protecting beneficiary data? Jen, anything in the chat?
No, there's nothing in the chat right now.
Okay. So I just want to assure all of you that all the tools that we have are backed and secure. So when you're working through us, you know that you're protecting your client information. And then just remembering always to not carry information with you, to protect and safeguard your laptop computer that might have beneficiary information. All of this is important to protect the information of your potential clients. And then, of course, not sharing with across forces and those types of things. Shelley, do you think we're on track with that, or is there anything else you think we should be doing to make sure that we're in good shape here?
I think just to always keep it top of mind, like you said. We take it of how we would feel if our name and address and phone number gets shifted out and you get the 20 calls like construction. It's not a good feeling, and we need the data to do our jobs, but we need to be secure with the data and make sure it is consistent with what we have.
Makes sense.
So in third-party marketing organization, TPMO, that was in the final Good question, Kevin. Final regulations, and I don't think that will change. Essentially, it's important that everybody understands that we're all in this together, whether it's a health plan or a broker or an agent or a marketing organization, that when we talk about marketing, it's anybody who gets compensated to perform lead generation or marketing or sales or enrollment. Whoever's part of that chain from beginning of marketing to the end of membership, it needs to follow all the steps from the beginning to the end to make sure that everybody's aware of what Medicare Advantage is or what supplement is. Education is the key. I know we've been in this for a very long time, and I remember going through training at FHP with learning at that time, but education and training is not one and done, which is why this is a great session, because it gives you a time to ask questions and learn more. My goal of every day is to learn something new, so I love going through these. In sense of securing your own data on your laptop, it is really important to have the ability to share it. I don't recommend. I don't have anybody that I recommend and virus protection for your computer. I don't know if anybody else on this who is involved, if there's a virus protection that they think is the best. The only thing I know is it's only good to have one, because if you have two virus protections, they kind of fight each other. But Erin, what kind of virus protection do you use for your system?
I've got to look up the exact system, so I'll share that out afterward. It's Norton. My IT just called in here and said it's Norton is what we use to protect our system. So Norton is a preferred grouping for us.
Yeah.
Hey, Erin, it's Leo.
Hi, Leo.
When you guys asked about, what we're doing, does that include, like, for an example, I just recently added a security feature with GoDaddy on not only just my email, but my downline's emails, just so we can send HIPAA protected information. Because I noticed that a lot of brokers, even into their third year, still use, Yahoo or Gmail. So I just figured I'd add that in.
So describe a little bit more what you're doing, Leo, to share with the group. So you did something on GoDaddy, but I'm not exactly sure what you did. So tell us a little bit.
So they sell different packages, and then when they know that you're an insurance agency, like there's other vendors too, apart from GoDaddy for the emails, but the one rep I spoke to had asked if I was an insurance agency, and they had a package specifically so that way we can encrypt emails. So like similar to like when a carrier sends you an email, they'll send you a notification saying that you have an email waiting for you in their box, but it's because it's in their encrypted box that you can access with a username and password. So I kind of went the same route with GoDaddy. So you get issued HIPAA compliant emails that you can send back and forth with the clients or providers, and it's encrypted.
And Leo, how does that work with your normal email system? Do you have to log in through GoDaddy, or can you log in through your regular, say, Gmail, and then it's just a feature that comes with it? How does that work?
So when you acquire the email, whether it's the email with the domain as well, through GoDaddy, you can set the email up to where you have it working with your Outlook app, because it is an Outlook email through Microsoft. So you can set that up through there. You can set it up through your phone regularly, the same way you do your regular Yahoo and Gmail emails. And then if you only want to send encrypted emails, there's a button towards the right where you can change the settings for that. If you want to just send a regular email where someone doesn't have to log in through a user account on the other end, you can just send it regularly also.
That makes it pretty simple. I know from our perspective, we've been putting the data with a password in terms of anything that we're sending that is considered personal health information. We've been putting that in an attachment with a password, or using tools like Sunfire, which are safe to do it. Genevieve, is there anything you would share? I know that we were also sending secured emails through Google at one point. Can you share that with the group?
Yeah, so there is an option when you're sending an email in Google. There's actually like a little toggle confidential mode. It's like a little lock with a clock on it, and you can actually type in the person's phone number and they'll send that person a code to actually open the encrypted email as well. So that's another option.
So it sounds like Leo's bringing one that I hadn't heard of before. It can be done in Google. You can certainly securely protect documents, but I think that the take-home message here is that you need an avenue that's easy for you to use to protect PHI as you're going back and forth. And that can include a client's prescriptions, their doctors, their personal information, if they're providing Medicare numbers, any of those things. It's really important that you're doing this in a secure manner. And these are some great ideas for how to do that. Shelley, do you think we're on the right track with that? Is there any other suggestions you have for us?
No, I think GoDaddy and Norton are great tools to use. The important thing is a lot of times the reason this was a new regulation kind of to make everybody on the same page is because sometimes we hear, I'm an FMO, so I don't need to do that. It's only for the health plans or it's only for agents. And this is basically saying it applies to all of us. So we're all in the same game and we're all in the same football field. So we all need to do this. It applies to all.
So if you're sitting there thinking, gee, I send my emails back and forth with no kind of protection, you need to realize that these regulations apply to you. So to everybody on the call, it applies to all of us. So some of you are really proactive and making smart decisions on how you're sharing information. For others of you, this may be an opportunity. So if you need help building and incorporating this into your business to make sure you're doing it in a compliant manner, let us help you with that. So you make sure that you're keeping beneficiary information safe and you're being compliant with the TPMO guidelines.
It's especially important. Oops, go ahead.
So I look for a lot of virus protection companies, and one of the biggest negative that I found out with them is, that's why I don't have the one that I want really, is that sometimes they make you lose emails, or you cannot get to the email that you want because of too much protection. Is that Aaron, is that Norton that you using didn't have any negative thing like that?
I personally haven't ran into any issues like that with Norton, Kevin, at least that I know of, because I wouldn't have gotten those emails. No, I'm just kidding. I think I'm doing pretty well with it, and it seems to work pretty smoothly. So it's definitely one you might want to try.
Okay, thank you.
Yep, that's no fun when you can't get emails because of information. Very, very frustrating. And sometimes that happens with health plans because they have very big brick walls. But as long as you have a good system, it should help. So essentially, I think everybody's on track. And as Aaron said, if not, reach out because it's important, especially these days with a lot of breaches going on. You've seen that in the news of breaches and how much it impacts. We all don't like to get that email in our inbox saying, oh, sorry, your information was shared and you should go on and fix your information because it's now out there on the black web. So it's important to take the extra step and make sure that it's compliant.
So do you want to keep on rolling with us, Shelley?
Yes, let's go to the next slide and talk about, we kind of talked about this. It's important that to share the written consent and to keep that as a document when you do get a beneficiary who basically got the disclosure, understanding that they can opt in or out to receive further communication, that essentially you are keeping that recording and document if you have it. Everybody has different ways to store that data. You just, of course, the most important thing is you need to make it available upon audit. So it needs to be stored in a way that you can retrieve it.
So Shelley, I have a question here. So for example, a beneficiary calls in, inbound call to the organization, is interested in attending a Medicare 101 or having an appointment new to Medicare. We maybe return a voicemail, we get them booked into activities, they attend those activities. what is required in terms of permission to continue to follow up with those beneficiaries? So how does that work, and how do we make sure that we're conducting follow-up to non-clients that have expressed interest in a compliant manner?
Well, essentially, a lot of people have different methods. I'd be interested to hear how everyone here, but in reaching out and having those, the great way to do it is to have a consent form so everyone can sign the consent form and opt into further communication. Once you get that, you have ongoing consent for a 1 year, and you can keep on going. And a lot of times the best way to do that is, especially now, working with education. AAP will be upon us very soon, and everybody's working through the bids, and bids will be submitted next week, and so we'll start getting data out. This is the time to reach out to your clients and educate them. And in that education, if you don't have a consent form, to get that out to members or your clients so they can sign it, and so that you can reach out with further information.
So Shelley, would a scope of appointment form suffice for that, or do we need a separate form to have ongoing communication?
Scope of appointment helps. A lot of people these days are taking the scope of appointment and adding that consent box to it, and that way it kind of cures everything that you need.
That would be a great best practice for us to add that instead of having to submit a separate consent form process. So are you working with partners that are having beneficiaries sign a consent form? Is it electronic? Is it paper? How's that working? essentially, there are some on the web, some SOAs with that consent. It would be great if we, had one and posted like a one. I know some health plans want you to use their SOA, but I think like 70% of the health plans don't require that. They just want an SOA, scope of appointment. And so as long as there's one to use, it would be great format to give to everyone so that you're consistent and you're covered. You're getting a scope of appointment, knowing what you can talk about, and you're getting a clear consent that you can call and talk to them. And right now in reaching out, you're not essentially reaching out to sell. You could be, but only if you have a consent. But you're reaching out to educate people and have groups like this or in different coffee shops and any way you get to see clients to basically go through it and educate. And while you're educating, you can educate on the consent form, talking about we don't want to share data, and it's really important that you get ongoing information and get it from the best source. There are a lot of sources out there, and if you go to Google, you're going to hear and see a lot of different things. I know I just saw on Google right now, and you probably have seen this too, with Google, there's an ad about how you can lose weight and you shouldn't use shots and you could just drink hot water and it works for you. And all you need is 10 seconds. And I feel the same is with misinformation about Medicare and at Medicare Advantage. So you really want to reach out and touch as many people as you can so they know who you are and that you're a resource, and get that consent at that communication. Super good feedback. Any other questions or comments on this area, Jen? Anything else in the chat?
No new questions in the chat.
Okay, great. So take us away, Shelley.
Okay, and next we're talking about lead generation and outreach. And it really needs to be, make sure that your lead acquisition and call center management strategy are compliant with the regulations, that they definitely have that consent so that it doesn't disrupt lead generation. And it encourages beneficiaries to share information as well as ensuring compliance. Sponsors and everyone must strengthen their data management systems to securely track consent. And this is essential. I don't know how some people are doing it, but some brokers, it says, hi Mark, that brokers are getting away with cold calling prospects without consent, using call centers. And that's, we're getting these regulations because that is happening and no one wants to happen. So hopefully with the new administration, we always know that there's one bad apple, but that's not, who we are or what we follow. I don't know, Aaron, if you have suggestions of if you know about a broker who is calling, what happens. But I have seen with health plans, when they get a hold of that information, they really reach out and try to validate that information to see what happened. And I see a lot of compliance officers reaching out to other compliance officers, letting them know there's a bad seed and following up with that. So that is one way to make that stop, because we don't want that to happen. It's not right and it's not fair.
Definitely not. I mean, I haven't dealt much in my area with identifying the bad apples and turning in the bad apples and those types of things. That hasn't been a part of what I've seen. But what I try to do for my team and what I want all of you, if you're new to me, to know is that we want to provide you with the tools to protect the beneficiary and protect yourself, right? So one of the ways that I believe is really important is, especially telephonically, is that you're recording every conversation. So even consent for future contact can be part of a recording. Really making sure that you're recording every step that leads towards the sales process. We have dial pad that we're offering our agents. We have taken the philosophy of recording every phone call, just to make sure that there's no gray area, we're not crossing over. And we always have that information available in the event of an audit or an allegation to provide, but it also protects the beneficiary as well, right? So we're kind of keeping both in mind. So just having the tools available to show that you're doing a good job is a best practice. And you have an opportunity to ask for consent. You have an opportunity to have all your information on file. It's easy to track it within a member's record, and you've got all that information to put forth should it be needed. Some of these bad apples, are out there doing different things. That is hurting our industry, right? So you'll end up talking to someone who's gotten multiple phone calls, multiple calls coming in, and they don't even want to answer the phone anymore. So we want to cut through that noise and be the organization, the team that is providing all the good education and information and sales ultimately in a compliant manner. So that, Shelley, I don't think we're in the sort of the end that is identifying the bad apples. It's more like, how do we make ourselves the best apple in the bunch and provide that type of service to our potential clients.
Yeah.
Can I say something?
Go ahead.
Sorry, Shelley. So I heard from my client that even some broker knock on the door cold-wise, they don't even have appointment, and they do that. I think the problem is Mark has a good questions, and I heard that many times. The problem is the beneficiaries doesn't want to complain. If the beneficiary doesn't complain, we're not going to get anywhere, because I heard it and I told the beneficiary, well, call Medicare, call CMS. They don't want to do that. And as long as they don't want to do that, we're going to be in this stock with these bad apples, because they are doing it every time. Sorry.
Well, I think a potential practice for that, though, Kevin, is if they were marketing or selling a specific plan, each carrier has their own compliance office. So if you really ran across that, you could, on behalf of your client, send the information about the broker and the product to the carrier, which would start an inquiry and could at least be there making noise in the sense of, this is not acceptable behavior. We're going to monitor this. We're going to monitor the sales that potential agent makes to weed it out ourselves. So we can be a resource. When they contact Medicare, unless it's a specific plan, like referencing a specific carrier, I'm not sure, and Shelley, you could maybe speak to this, but unless I say, hey, this is if I'm a member and I say, this is an allegation, this broker is representing XYZ carrier, I'm not sure what they would really do with it if it didn't reference a carrier. Do you have feedback on that?
Yeah, I think that's a great point. It's essential, the old saying, if you see something, say something, you hear something. I wouldn't make a beneficiary call. I mean, you could provide them that opportunity or communicate that they can do it. And, 1-800 line for Medicare. But if I hear a lot of times talking to beneficiary, they don't tell me who it is or don't give me the details. But if they do, then I am going to reach out to that health plan and let them know that it's happening, because we want to protect the beneficiaries and we're all in this together. So definitely, if you know who the agent was or what the plan was, either reach out to somebody who can have that communication with the compliance officer. You can always reach out to me and I can help you with that. But if you don't want to be, kind of part of the message, I'd definitely be able to do that. We do that all the time when health plans have questions and want to ask CMS. We ask the question for the health plan because they don't want to go ahead and be on that chain. So we can add to that communication. It's kind of a handshake. We got to work on this all together so that it works.
And in order to do that, I think there's really three things you need. You need the name of the guilty party, right? You need the name of the plan, and then of course what was done. And then from there, Kevin, if you didn't want to manage yourself, Shelley will take referrals. I'm happy to follow up on things like that as well, because it's so important to create a compliant culture. We don't want to be tattling, but at the same time, it's kind of like when you're kids, right? It's nobody likes a tattletale, but if it's actually hurting someone, harming a Medicare beneficiary, then it's important to make sure that information gets out there. So I think that is really important to, create an even playing field, and also to protect our industry, right? The credibility of our industry is really at stake when agents are being bad apples like that.
Absolutely. And as Mark said, getting 15 calls a day, even when he's only 44, it happens to everyone. And as Aaron said, essentially, we don't even want to answer the phone. And I'm like that too. I have a landline, and if it doesn't say who's calling me, I don't even answer, because I get those 10 calls a day that are selling me something. And at this point in my life, I don't want to be buying everything. And I do a lot of my research so I can determine what I need to do. And we all have such limited time in doing what we need to do. We don't need to take all those calls. And it's kind of frustrating when you get a sales call and you got to tell this person you're not interested. Not a good feeling.
Right. And also it can be very confusing, particularly to this market, because it may feel like you do need to do something. So then you're kind of operating in fear and not knowing which way to move. It's really bad. So Shelley, keep us rolling here.
Okay. And just one other comment to Mark, his question about it's frustrating when you have a client and they get switched and they really didn't know they got switched. It is so harmful, because once you're in a health plan and you have referrals and you get switched, those referrals are not good anymore. So it really is harmful to the beneficiary. And like we've been talking about, if you know about who's doing this and you know what health plan has this issue, you really need to speak out, because we want to protect the beneficiaries. So hopefully you will say something. I just thought I had a visitor coming to here. My kitty cat was almost coming out and wanted to be on the show.
Yeah, Gert is the same.
So in the sense of managing agent and broker relations, it's really important to have health plans all have broker relations. And the more that the communication happens, it's important to work together so you get the right resources and the right communication. You have the right documents, and you can get more information by each of the carriers. But that information is really important. I think in the old days, it used to be everybody creating their own documents, and that got into a lot of problems. But I really don't see that happening a lot. But it's important to also have effective oversight. I'm not sure, Aaron, what kind of oversight you do about agents and brokers, but I know we as a consulting firm, we do reach out and have a lot of oversight to different FMOs. So essentially, we can help everyone be educated and knows what's working and what's not to help identify anything that's not correct. So it's important to know what the quality standards are and the compliance requirements are. And if you have any downstream, downline, it's important to have that oversight. Part of the oversight is just communication like this. So essentially that everybody stays and keeps front of mind what's compliant and what's the right thing to do.
So the thing is part of the oversight, Shelley, that we're providing is checking in to make sure people have these tools. At the same end, it's making sure you as agents and listening, you feel like you're lined up, because if for any reason not, let's have a consult and make sure that all the components are set, you feel comfortable, and that we're operating in the most compliant manner possible. A couple of you have come across allegations, and we were able to very easily dispute those allegations because of all the call recordings that made sure that we had a compliant finding in the information we communicated. We've also had carriers requesting audits, just auditing how the conversations went. And so all those call recording mechanisms and our ability to listen to those have helped us to do better and to operate in a compliant manner. And we've generally taken it a step further, Shelley. So obviously we want to be compliant, and we don't want to be in compliance jail with any kind of carrier. So we've been very successful with that. But by listening to the calls and attending appointments, attending seminars, and monitoring that activity, it also gives us an opportunity to provide additional feedback unrelated to the compliance request. So just making sure that not only are we operating in a compliant manner, but that we're creating a sales opportunity that makes sure that the beneficiary is very clear on what they're getting, understands the benefits, understands any risks or opportunities within their program, and they're taking advantage of that, and they're making a good decision. So we're really trying to take all the components to not just be compliant, but really just putting ourselves in the shoes of the beneficiary to make sure they're getting the most out of their coverages.
Especially on that with switching. We work with a lot of health plans, and they're trained their call centers. And I always hear from call centers exactly that. We had a member, and they called me and said somehow they got switched to some other plan. That's not what they wanted to do. So they also hear that complaint. So you're not in that alone. It's just, it's not worth the money to hurt a beneficiary. And that communication needs to go out so that everybody understands that. Next slide.
Speaking of sales allegations.
Yes. So everyone knows what a sales allegation is. And it's kind of, I've talked about how my mother was used to sell out in Ventura in California. And she was always worried about sales allegations. And I used to tell her, it's part of the job. We're working with beneficiaries. There's always something somebody's going to misunderstand. It's a great process to have an allegation, and it's just an allegation. It could be just a miscommunication. The important thing, like Erin said, it's great that we have tools to listen to, so we know what was said. And I know a lot of times we get rushed in talking to beneficiaries, and that's why reaching out now with communication helps building that communication. I say my goal is to learn something new every day, and that works with beneficiaries. It's important to reach out when you have time and talk to your client list to educate them and have that communication so that they understand. As long as you keep your documentation, those allegations are easy to solve.
So Shelley, you bring up some really good points. And we had talked about the call recording earlier, but a lot of you are using Salesforce or using another CRM tool. There is an opportunity, for example, if you go on a face-to-face appointment, to document your experience that you had on that face-to-face appointment, what materials were given, what sales process you did. Also, having consistent sales processes, always using the summary of benefits as your source of truth for providing information, those types of things can all help in the event that you have to explain an allegation. Now, some of you have had an allegation, they happen. Like Shelley says, it's part of doing business. It doesn't mean you're a bad person or not doing the right thing. You wouldn't be on this team if you were, but it's important to respond timely. Don't panic, right? It's just a matter of providing that information, explaining, and providing it. If for some reason there's something additional you can do, you're probably going to get training and coaching on that. A lot of times they're going to be found unfounded. So as long as you're doing the right thing, you're going to be okay. This is part of the process, but documentation, recording, consistent practices, those are all going to play well into responding to an allegation. The key is respond timely. And if you ever get an allegation and I'm not copied on it, be sure to talk with me, because I can assist you through that process and make sure you have all the tools you need to respond timely and correctly.
Yeah, absolutely. And as I was talking about my mom, essentially, she started losing hair because she was so worried about it and, concerned when that happened. It's not a bad thing. We want the communication. We want somebody to speak out. And the more, you give them communication, and also have a document that they're left with, or they get it in their email. So they have the information, not only hearing it from you, but they have it in black and white. So scope of appointment, I think this is almost at the end here. It requires everyone to collect SOA, and everybody knows that. There is the 48 hours before a meeting. However, there's exceptions to that. If a beneficiary calls in and wants to talk about it, it's an inbound call. The 48-hour doesn't apply, but you still need to get the scope of appointment. Some people think because 48 hours doesn't apply, they don't need the SOA, but that is not correct. And again, the SOA is good for 12 months. So you can continue talking to them and educating and making sure that you're giving them information about the best plan for them and their specific needs.
So a couple things just to add on to here, Shelley. So every single agent on this call has access to Sunfire. It is definitely ideal for scope of appointments. Just so you know, if you're not using it, you can set up a templated email where if you have an inquiry, you can send a link to the beneficiary where they can add in their prescriptions and their doctors securely, and it will automatically prompt them to complete a scope of appointment form, which is going to allow you to have that selling conversation. We're using that as a best practice for new leads that come in. We're saying, hey, you should attend a 101. Here's a link to provide your information and to sign a scope. So then we've got that inherently set up to have that appointment at a later date, just 48 hours out. So really, really important there. The other thing that we have is we have approved scripts that we've gotten from our carriers to do scopes of appointments over the phone. One of the things that we're going to be incorporating this year is, instead of just having access to our in-house team to answer the phones, we want to build teams of agents that are certified and ready to sell, to have you have certain sort of desk hours where you'll have access to our system and can answer the inbound calls, take the scope yourself verbally, and help persons through the sales process if it's open enrollment. So in the past, we've had a lot of opportunities where people are calling our number ready to buy, but the appointment is set 2 days out. To prevent that, we're going to be able to have you answering the phone directly, taking the scope, and be able to help them through the sales process immediately, which is what they're really looking for during a busy time during open enrollment.
That's a great idea.
It's going to be great. Yeah, we're really excited about it, and we won't get a lot of drop off, because what happens is they call somebody else if they can't reach someone right away to help them with the information. So it helps them get the service they need and prevents not being able to find people. Something I've learned today, so Shelley says learn something new every day. When I've had a call drop, I'm redoing the scope. If it was a verbal scope, or redoing all my disclaimers. It looks like here, Shelley, what you're saying is we don't have to redo things if the call drops. We can just continue on business as usual. Is that a fair interpretation?
Absolutely.
Okay, so that's really great. So what questions do people have about scopes of appointments? Any questions out there? Any comments?
Erin, this is
Yes.
me.
Okay, go ahead.
So I just want to double, triple, quadruple clear that if it's an inbound call, we can assist the member, and it does not have to be 48 hours.
That's correct.
That's
Okay.
correct. But make sure you have a scope on file, Elena. If you don't have a scope that's within the 12 months, and you have to get a scope before you assisted them, but you could do it verbally.
Right, but as long as I have the scope of appointment, I can assist them, because first I have to get the scope of appointment, but I can talk to them right away. I don't have to wait the 48 hours, correct?
100%.
Correct.
As long as it's
Thank
an
you.
inbound call, which is a big deal. So we didn't know that at one point. Now we do, which makes us want to be more proactive in having agents answer the phone the first time, so there's not a waiting period.
It's not right to make a beneficiary wait 48 hours. CMS put that, actually, Dr. Cynthia Tudor put that into effect. She's no longer with CMS, but she did because she thought it was protecting the beneficiary from, getting bombarded and coming in, and they really don't want to answer, or they don't want to be talking about it, but they're bombarded. And so giving them 48 hours kind of gives them the opportunity to think about it, as well as reach out to their children or somebody else and say, somebody called me, I'm not sure what this is. So it gives them that leeway. But if they're calling and they're interested, you need to just get the scope of appointment. They're calling in. And on the scope appointment, you need to go ahead, also document. I'm not sure in Sunfire is a way to document, but somewhere you need to document that it was an inbound call and they were interested in the information. So
It is on there.
that's perfect.
It gives us the option to add it. Plus, we can have a recording of them calling inbound and so forth as well. So I think that double up is going to be good.
Perfect. We kind of talked about
this call recording. This is a beautifully transitioned presentation.
So we want to make sure calls are recorded in the notary. We know that's done with your tools at this point. And it's basically, you need to record all calls with beneficiaries, including when it's marketing, sales, enrollment, and the retention is for 10 years. So I know that's a lot of data storage, but it's really important.
So there's one thing I want to add to this, Shelley, which is a watch out that I've seen across agents is agents are I wouldn't say 100%. My agents are 100% perfect when it's a sales call. We know it's a sales call of recording it, either in Sunfire or in Dialpad or whatever system you're using with me. However, it's really important, and I just want to remind everybody that every sale or every call in the sales process needs to be recorded, not just the final one with the application. So sometimes I've listened to call recordings in the past. I've seen continuous improvement on this, where a beneficiary buys something, but it's clear to me that something got talked about in a prior conversation, right? It's like something about like, oh yeah, we talked about that before, or yeah, you told me about the medical group before, that type of thing. That entire chain of conversations need to be recorded if you're selling over the phone. Now, if it's face-to-face, you're obviously not recording it, you're documenting it in your tool, but it's really important because in the event of an audit, it's going to be really noticeable if there was a prior conversation that wasn't part of that grand finale. So you want to make sure every conversation in the sales process is recorded.
Yeah. It is essential because when CMS pulls and hears those recordings, they're going to ask for you to retrieve the previous recording that was part of that sales process.
So disclaimers.
Your favorite. Disclaimer language. We do know what the language is and when it's required verbally within the first minute of a sales call, and with the beneficiary through electronic communications as well. So that means emails, chats, anything else. And it should be easy to see on your website. So any communication on your website or any kind of documents you send out needs to have the disclaimers that protect the beneficiaries.
And just to tweak this disclaimer a little bit, like what we're putting on our disclaimer is we offer X amount of plans or we work with 11 carriers that offer 65 different plans in your area. We have tables set up for the county level basis on this. And we give them the option that they can always call 1-800-MEDICARE, go to medicare.gov, or contact their local state health insurance program or SHIP for help with your plan choices. So I'll make sure that you guys all have that disclaimer. But if you're smart, you're going to make sure that for a given area, you're contracted with all the plans that I'm contracted with, because we're keeping a table of that. So if you're in New York and you're like, gosh, I'm going to go sell in San Francisco today, you can easily access the number of carriers we work with, the number of plans we offer, so you can plug that into that area when you're reading the disclaimer to the beneficiary. So this generic one I think is good for websites, but when you have the actual zip code of the beneficiary and you know where they're located, you must declare the number of organizations you work with, the number of plans you offer, and give them those options. It can be really complicated if you sometimes sell in areas that you don't have that sort of information memorized or readily accessible. We have that in a shared drive. We can share that with you. So if you consistently line yourself up with all the plans I offer, then you're going to be in good shape for accessing that information.
And that definitely is a best practice and compliant. Not everybody has the tools to do that, but when you do, it makes it easier for the beneficiaries to understand, and you're giving the best practice, more information for those beneficiaries.
And just to kind of reiterate this, I mean, we're saying this anytime we're having a sales conversation. It's at the very beginning of every call. We're also telling them all of our calls are recorded for Medicare compliance. And again, we're putting it at the end of any email that is having a selling conversation. So anything about plan benefits or changes or those types of things, it's included. All right, so this is the coup de grace here, the grand finale, elements of a compliant phone sale, right? Because a lot of us are selling over the phone. So Shelley, can you walk us through what do we need to do to make sure that we're passing all the tests from a compliance standpoint?
So CMS does have a document that talks about all the things you need to have as a best practice. A lot of agents, brokers, and FMOs have that tool, so they check box as they go through. That's great documentation to also keep, but essentially you need to start with a clear communication and introduction of who you are and who you represent, and with the disclaimers and the company's name and the purpose of the call. So it's really clear to the communication exactly what you are doing. And this basically builds trust with potential customers, and it keeps the trust going with your current clients. So of course the script, as we talked about, must have the disclosures and the fact that the call is being recorded, as Erin said, and any relevant disclaimers, as Erin has on your website, as well as the details, the more the better. And of course, you can't have misleading statements like, we're Medicare, or we can offer you everything free, or we can give you these benefits, and they're not part of this channel. So the script must include a section of obtaining consent, and we kind of talked about that. So all of this is rolled into one. The scripts are important. Even though you have a script, I hear a lot of complaints like, a member doesn't want me to read a script. And even though you have a script, it's not like you have to say, see Tom run, see Tom catch the ball. You don't have to read it verbatim, but you need to cover the points and make sure they're covered, that when thinking about it, Erin or CMS can go through a recording and hear you hit all the points that are required. And this slide is just as an action plan of all the things we were just talking about, the best practices to identify all FPRs, because everyone needs to have that. Most health plans, when they audit an FMO, are giving you a spreadsheet to fill out of who your downstream are, who your agents are, who your delegated entities are, if you're using any call center. So that is getting collected by health plans at this point. So it's really important to have that information. It's also important to make sure that your contracts are together. And go ahead and go to the next slide. I'm sorry. And this kind of shows, this is one health plan's audit tool where they're looking for what they call a critical element about training and education to see what the policy and procedure is about the training and gathering evidence of the training. And they collect policies and procedures about it, evidence that the PNP is compliant, and any kind of comments. So this tool happens to be like 13 pages long from this health plan, but it goes to everybody. And go ahead. My bottom line is knowledge is having the right answer. Intelligence is asking the right questions. That way in the chat, we keep saying, ask a question. I've always not been really good at asking questions. I like answering better, but the way you ask a question, you can get 3 different responses. So it's really important to be able specifically ask the question with details so we're answering what you're looking for.
Thank you so much, Shelley. Just want to open up. Are there any other questions or comments out there? Jen, anything in the chat?
No, Shelley's addressed it all already.
All right. Well, Shelley, thank you so much for joining us again. I really appreciate it. All the agents and brokers that joined today, thank you so much. You're showing your commitment to selling in a compliant manner. The recording will be published and available to you if you want to revisit it. And please reach out to me if you need help with your own compliance plan, making sure you have all the components in place to sell in a compliant manner. If you need access to any of the tools we discussed today, or really have any questions or challenges, even when it comes to making sure you or other agents are operating in a compliant manner, anything can come forward. We really are committed to our Medicare beneficiaries, and this is one of the ways we show it. So just wanted to thank everybody for joining today. And Shelley, thanks as usual for your wonderful insights and for being available to us. We really appreciate you, everybody.